Hello, this is Dr. Yael Halaas, board-certified facial plastic surgeon here in New York City. And today we're going to go over the most frequently asked questions for facelift. What is a facelift? So a facelift actually kind of is a misnomer because in layperson's terms, it could really be anything that's lifting up parts of our face. But in reality, when we're talking about a facelift, we're actually talking about a targeted procedure that really is dealing mostly with the lower third of the face, as well as the jawline and neck. And what are we doing? There are several different types of facelift that vary on surgical technique, but all of them are really addressing sagging of the lower face, jowls, and sagging heavy neck, and particularly those troublesome platysma bands, those bands that can appear in the neck. And that's really what the surgery is doing. It's not removing necessary wrinkles or retexturizing the skin. It's not lifting up the brows. It's a targeted procedure right here, jawline, neck, lower midface. Am I a good candidate for a facelift? It's really people who are starting to see the aging effects from gravity pulling down on that lower face. So for people who are starting to see a lot of heaviness, heavy folds, people who are seeing jowls and losing that defined jawline, and really it's the neck. How many times have we heard, I hate my neck? But when we are dealing with heaviness underneath here in the neck, sagging, the double chin, or even on thinner people, a lot of redundant skin, plus those bands coming down, that's when you know you're a good candidate for a facelift. What are the different types of facelift? And there are a number of different types. There are a lot of different layperson terms. Sometimes you might hear a weekend facelift or a local lift, but really what they're all referring to is a surgical procedure that has an incision that runs basically hugging the hairline here, usually delving into the ear here, hidden as we possibly can, hugging around the ear and then heading back towards the posterior hairline. And from that access point, we can really then encounter the deeper structures of the face. And which type of facelift often revolves around a structure known as the SMAS, which is basically a superficial muscle encasing fibrotic envelope that wraps around our facial muscles. And there are two main types of facelifts. One would be a SMAS facelift, where you are actually lifting or folding over or sewing that superficial muscular envelope, or something that we call a deep plane facelift, where we actually incise through that SMAS and lift everything up together all in one, so that the muscles and skin are all lifted up together. The goal may be to do the deep plane facelift from time to time. A SMAS plication can also give a great result and may be indicated. Your surgical history and your surgical anatomy may dictate which approach that we use. Both have been proven to show excellent results, both cosmetically, natural result, as well as having good longevity. What is the difference between a facelift and a neck lift? So, as we were just discussing, a facelift is actually dealing with the jawline and the neck below. So you are going to get improvement in both the lower third of the face and the neck. From time to time, there is a situation where perhaps the neck is very heavy, we have very heavy salivary glands, where we want to deal in an isolated manner or in conjunction with our facelift with that heavy neck or specific issues in the neck, and we combine that with the facelift. The neck lift portion is done through a small incision right here underneath the chin, which heals extremely well. And from there, we can access some of those platysma bands, the fat, some of the muscle issues, as well as if there's an issue from heavy salivary glands or just not great positioning naturally of one's anatomy. How should I prepare for a facelift surgery? Well, we're going to give you extensive preoperative and postoperative instructions. But in general, it's great to plan to do a facelift when you can take about a week or two for recovery, as well as keeping in mind that you need 3 weeks off from strenuous activity. Also, it would be great to start reviewing what medications you're taking, and that includes vitamins and supplements, all of which can contribute to blood thinning, which would lead to more swelling and bruising after the procedure. Also, if you're considering surgery, it's always wise to optimize your medical condition. So check in with your primary care doctor, cardiologist, endocrinologist, just to make sure that you are really in great shape to have a surgical procedure. What happens during the facelift procedure? Well, step by step, you come into our office and we help you get comfortable and get ready for the procedure. At that time, you're going to meet our anesthesiologist, discuss the level of anesthesia, which often is a type of IV sedation, also known as twilight, that you'll be comfortably sleeping through the procedure. We can also perform facelifts under local anesthetic. In those instances, you're actually pretty awake, and we can do most of the surgical approaches. Once you've met the anesthesiologist and fully prepared, we go into the operating room. There, the anesthesiologist will place your IV, and you get to take a great nap for a couple of hours. We prep the area and then make our incisions and begin the procedure. It can be either a mass plication facelift or a deep plane facelift. It can be also addressed through the neck as well for any troublesome deep neck issues, such as muscle issues or gland. Once the procedure is done, a wrap is placed around the head and the neck area, which actually is left in place for 24 hours. You get to recover and go home either with a family member or with nursing staff that we help coordinate for you. And you actually feel pretty comfortable. Plus, we have so many medications to help you feel comfortable as well. We will have gone over all the instructions with you, but we'll also go over the instructions with your family members to make sure that they understand what you best need in the next coming days. I do see you in the office the next day. Occasionally, if a drain was placed, the drain may be removed at that first post-operative visit on that first day. Or if not, if there is a drain for some deep neck procedures, in that instance, the drain will be removed about 3 to 4 days later. I like to see my patients and be in contact with you, so we may see you a couple of times during that first week. And then we'll see you either day 10 through 14 to remove any of the sutures that we have behind in this ear area here. Remember that for those first 3 weeks, you're not going to be doing any strenuous activity and no heavy lifting. So treat yourself well. You don't have to stay in bed, you're not bedridden, but no exertion. How long does a facelift procedure take? On average, I would set aside 3 to 4 hours for the surgical procedure. Maybe a little bit longer, depending if there's deep neck issues that have to be addressed as well. And then very frequently, the facelift procedure is combined with blepharoplasty, with eyes, with brow, maybe a fat transfer, and those can add anywhere from an hour or 2 more to the operative time. What type of anesthesia is used during a facelift? And there really are essentially 2 options, local or general. Local, yes, you can have a facelift under local anesthetic. Most commonly, it's used for the mass plication type facelift. And essentially, you are awake, maybe with a mild oral sedative. And I love actually talking to my patients and keeping you comfortable. And we can do a great procedure to help you have a rejuvenated and refreshed face, lower face, jawline, and neck procedure. Most commonly, when doing a facelift, however, particularly for doing a deep plane facelift, I would recommend some IV sedation, which has you generally asleep. That can be performed either with airway protection with a tube, intubation, or can just be provided with nice, comfortable IV sedation. Where will my facelift be performed? I perform over 90% of my surgeries here at our own accredited operating room center. Our Quad A SF fully accredited operating room adheres to the highest standards. That's incredibly important, particularly in the state of New York, but everywhere. It's so important that you know that your doctor is doing the utmost to secure your safety. Indeed, when I first built my office, I actually became an OR inspector so that I could be really well versed in all the details and minutiae to make sure that everything in my operating room was performed to the utmost standard. In addition, I have a team of board-certified anesthesiologists who I would and have entrusted my own family members because I feel so strongly in having a meticulous, detail-oriented, fully accredited operating room here in New York City. What is the recovery process like after facelift? As with any surgery, the first 3 days are when you could expect to have the most swelling. For the first 24 hours after a facelift, you will have a wrap fully around the face and neck. Don't worry. You'll be able to see, and you'll be able to eat, and you'll be able to swallow, and you'll be able to speak. But you're going to keep your head elevated, relaxing at home. And then after the 24 hours, I will see you in the office and remove that wrap, potentially a drain if you have one. For the next 2 days after that, keeping the head elevated and icing will really help to minimize that swelling. Additionally, on day 3 or 4, if there is an additional drain, that would be removed at that time. Most patients don't feel that the procedure is really that painful. Of course, you may experience discomfort, definitely may be feeling tightness, and no one's judging on how much pain you may feel compared to another patient. You will have pain meds, you will have medication to sleep, anxiety, antibiotics, medication to decrease swelling, whatever you need to feel comfortable and supported. Hopefully, once those 3 days have passed, we will not have accumulated that much swelling. And actually, with your hair down, you might look pretty good. We're going to avoid strenuous activity for this first week, as you will for the next following 2 weeks. In total, 3 weeks of no strenuous activity or lifting. Usually at post-op day 7, any sutures here will be removed. And day 10 through 14, sutures behind here will be removed. Over the course of that first week and that second week, that initial swelling will really start to resolve. You will have frequent visits with me and my team, and if need be, we can recommend things like lymphatic massage, radiofrequency treatments to help get you recovering even faster. Plus, we'll have so many good postoperative instructions, including really great, helpful naturopathic medications to help reduce that swelling as well. How long does bruising last after a facelift? With meticulous following of our instructions, bruising can actually be quite minimal. But if some does, and of course it can, because surgery can cause bruising, hopefully most of that will be resolved within the first 10 days. When can I return to work or normal activities after a facelift surgery? It depends a little bit what type of work you do. Remember, there is no strenuous activity or heavy lifting over 15 pounds for the first 3 weeks. So if your work involves vigorous physical activity, you have to wait 3 weeks. For those of us who are working at a desk or a computer, you can actually resume your computer work pretty quickly. I would give yourself a day off, 2 days off, so that you can be icing, especially during those first 3 days. But you will be able to pop onto your computer and get some work done. In terms of if you have to go on Zoom, well, with your hair down, maybe after that first week, I think actually you're going to get away with it. To completely go back to the office and have no sutures even behind the ear, I would say you have to wait 2 weeks. If you have a major event, such as new headshots or a wedding, I would say best to give yourself 6 weeks to recover. Will I have visible scars after a facelift? Initially, we are making those incisions, which run around this temporal tuft of hair, then runs right in front and then cuts usually into this ear right here, an area we call the tragus, retrotragal, then loops around, usually in a fine line that we have around our earlobe, up, back, towards the hairline and the posterior, right in front of the posterior hairline. Usually, it heals extremely well, but it will take time to heal. Obviously, a fresh incision will look red for a couple weeks, possibly months. As you can see here in this before and after picture, the incisions actually heal incredibly well, allowing the patient to wear their hair with a variety of hairstyles without the appearance of highly visible incisions. But overall, the incisions do fade and the patients are able to wear their hair short or wear their hair up without feeling like the incisions are highly visible. How long do the results of a facelift last? A good rule of thumb is that a facelift should last anywhere from 7 to 10 years. Some patients, depending on their skin type, may want to do a small tuck-up at 5 years. But overall, you will never age as severely as if you had never had the facelift. It is a worthwhile investment that will keep you looking refreshed and younger, no matter at what point you do it. Are there any non-surgical alternatives to facelift? The most common alternatives to facelift surgery are some of the things that you may have already heard of or even tried. Things like Botox and fillers. They can be used to diminish some of the signs of aging. For instance, Botox can be used for the bands in the neck to help them appear less strong. Fillers can be used subtly and artfully to improve some of the fall that we see in the cheeks and also hide some of the imperfections along the jawline. Moving up from there, we have many of our energy-based devices, of which I have done a lot of research and offer the most effective and safe technologies here in my office. What are some of those technologies? For instance, SoftWave is a great possibility. It has absolutely no downtime and uses ultrasound technology. Microneedling with radio frequency. Some common brands are Morpheus, Exion, which I was one of the investigators for, that allow for skin tightening and improvement of skin texture and can be used all over the face, neck, and jawline to get a tighter result. One technology of which I am specifically proud and helped develop is that of M-Face. If we think about it, similar with our bodies, our muscles get weak over time and everything falls down with gravity. That applies to body muscles as well as face. For the body, we can use M-Sculpt to tighten our muscles and improve our posture, lift everything. With M-Face, we are tightening, toning, and then essentially lifting, fighting gravity with for our facial muscles. And what we're doing here is, with the major elevators of the cheek, can also be used for the brow, can also be used for some of the neck muscles. We can strengthen the muscles so that they reposition, lift up that volume, and give us a younger appearance. Moving into the surgical world, minimally invasive world, we have procedures such as FaceTite with MyElevate. With FaceTite, we are going to be using radio frequency through a small cannula that runs underneath the skin surface to use that radio frequency energy to help minimize some of the heavy fat that we might have in the jawline and neck area, and also stimulate some collagen so that we can get some tightening and repositioning. With the MyElevate suture, we are using percutaneously without incision, a suture that will help to cut the platysma bands and kind of hammock everything up. That can give a great result. None of these are going to be equal to what we achieve with our biggest tool in the toolbox, which is surgery. But all can be used to get an improvement. And what's so key and important is to discuss with the surgeon what it is, what your goals are, and what type of downtime, discomfort, recovery you're anticipating and fits with your lifestyle. Can a facelift be combined with other procedures? Absolutely. Many of the minimally invasive procedures that help to retexture skin work very well with facelift. Very frequently, what we're doing with a facelift is a good tailoring job. We're cutting and sewing your fabric into a better position. But that fabric itself may inherently need some ironing. And that's where things like lasers will come into place. A CO2 laser is a great way to smooth and essentially iron out some of the imperfections in the skin, and is about a 1-week downtime that complements perfectly with the recovery from a facelift. What other things can be combined with facelift? Well, a facelift is really just lower face. If you wanted at the same time, you could combine it with a lip lift, chin implant, upper or lower blepharoplasty, or brow lift to have a completely rejuvenated look and addressing all the issues that you may want addressed while just having one recovery time. One procedure that I really love to combine with a facelift is a fat transfer. And that's where we're taking essentially body fat, usually from the belly or the thighs, harvesting it and using it to restore volume, for instance, to the cheek, temples, any number of areas where over the years we have developed unwanted contours, hollowness, indentations. The fat can really help to rejuvenate by restoring that volume, but also the stem cells in fat often give a brilliance to the skin that really harkens back to our younger, healthier, more rejuvenated days. Can facelift scars be improved through any interventions? Absolutely they can. And that's something that we have a lot of in this office. Having served as the chairwoman of the Emerging Trends and Technologies Committee for the American Academy of Facial Plastic and Reconstructive Surgery, it drew on my tremendous experience doing innovative technological studies, some of which using exosomes, biosomes, energy-based devices can all be employed to help minimize the appearance of facelift scars. I would love to discuss some of these options with you to help make your surgery as smooth, rejuvenating, and undetectable as possible. How can I maintain my facelift results? I have so many great ideas because working with so many new technologies, there really are so many ways that to complement and maintain a result and keeping a youthful, completely natural, rejuvenative process going for you. What are some of those ways? Sometimes it's as simple as good skincare. Using biosomes, exosomes, retin-A, we can really help to maintain our skin quality and skin texture so we have a perfect match between our surgical result but also the fabric that's encasing that great new anatomy. Other things that can be used to help maintain a great facelift result is technologies such as M-Face and SoftWave, as well as microneedling and radiofrequency, all of which can help reverse the aging process of the skin, restoring our collagen, increasing our elastin, increasing our hyaluronic acid, so that we can really maintain those results and look and feel as natural and great as we are inside and outside. Are there any financing options available for facelift? Indeed they are, and I encourage you to speak with my patient coordinators to know which options are best for you.